The surgeon threw the metal tray across the operating room. It slammed into the wall so hard that everyone froze. Monitors were beeping. A patient was bleeding on the table, and the surgeon turned to me with a look I'll never forget. "What the hell did you give him?" The entire operating room went silent. Every nurse, every resident, every technician, all staring at me like I had just poisoned the patient. Then someone behind me said the words that almost destroyed my life. "That medication came from his station." Within 30 minutes, hospital administration locked my badge. Within an hour, my supervisor told me not to leave the building. And by sunrise, there was already talk that I might lose my nursing license. But here's the part nobody in that operating room understood yet. The person who blamed me was the same person who had been quietly breaking hospital safety rules for weeks. And the reason they tried to pin it on me was because earlier that night I saw something they were never supposed to do, something that could shut down an entire hospital department. My name is Daniel, and until that night, I had worked in trauma care for almost 7 years. Trauma units are different from normal hospital floors. People don't come in with simple problems. They come in broken. Car crashes, gunshot wounds, severe internal bleeding. Every minute matters, every decision matters, and every medication must be exactly correct. Because when trauma medicine goes wrong, it goes wrong very fast. That night started like every other chaotic night shift. Ambulances arriving non-stop, stretchers rolling through the hallway, doctors shouting across rooms, the smell of disinfectant and adrenaline everywhere. Around midnight, a new nurse joined our trauma rotation. Her name was Claire. She had transferred from another hospital system. On paper, she looked incredible. 5 years of experience, advanced trauma certification, recommendations from 2 different hospitals. Management was excited to have her, but something about her immediately felt off. Not incompetent, not nervous, just too confident. The kind of confidence that usually appears when someone thinks the rules don't apply to them. At first it was small things, skipping double-check procedures, rushing medication prep, ignoring verification steps. Those things might not sound dramatic, but in trauma medicine they're serious red flags. Still, nobody wanted to accuse the new nurse of anything. Hospitals are political places. If you report someone too early, suddenly you become the problem. So most of us just watched quietly. Then something happened about 3 weeks later that stuck in my mind. I walked into the medication room to grab antibiotics for a patient. Claire was inside, standing at the medication cabinet, holding 2 syringes. She looked startled when she saw me, almost like I had caught her doing something she wasn't supposed to do. "What are those for?" I asked. She smiled quickly. "Prepping for the trauma patient in room 3. But something didn't make sense, because the medication she was holding wasn't ordered for that patient. I knew because I had just checked the chart 10 minutes earlier. For a second, we just stood there. Then she casually placed one of the syringes back into the tray. "Doctor just updated the order," she said. Maybe that explanation would fool someone else. But trauma nurses memorize medication protocols like pilots memorize flight checklists. And that drug combination made absolutely no sense. I thought about reporting it. But I didn't, because the shift was chaos. And honestly, I assumed she had simply made a mistake. That was my biggest mistake. Because 2 weeks later, the operating room almost turned into a disaster scene. The patient was a construction worker who had fallen from a building. Severe internal bleeding, multiple fractures. The trauma team rushed him straight into emergency surgery. Everything was moving fast, too fast, surgeons working, anesthesiologists adjusting medications, nurses preparing transfusions, and Claire was responsible for preparing one of the medications used to stabilize the patient's blood pressure. She handed the syringe to me. "Ready," she said. I checked the label. It looked correct. And the surgeon was already shouting for the medication, so I administered it. 10 seconds later, the patient's heart rate spiked. 20 seconds later, the blood pressure dropped. and 30 seconds later, the heart monitor flatlined. That's when the surgeon threw the tray, and someone pointed at me. But what nobody in that room realized yet was that the syringe I used had been switched, and the hospital medication system records something extremely specific, not just who gives a drug, but who prepared it. And once the hospital IT team started digging into those logs, they discovered something about Claire that shocked the entire department. Something that explained every strange thing I had noticed for weeks. And once the truth came out, Claire didn't just lose her job, she disappeared from the hospital industry completely. The first thing hospital administration did was lock my access to the medication system. That alone told me how serious the situation was. In hospitals, medication errors are treated almost like crimes, not because people want to punish nurses, but because mistakes can kill patients. By the time I was escorted to the supervisor's office, rumors had already started spreading through the trauma department. People whispering in hallways, staff looking at me differently. The same co-workers I had worked with for years suddenly seemed unsure if they even wanted to stand near me. The nursing supervisor sat across from me with a stack of printed reports. She didn't look angry. She looked disappointed. "Daniel," she said calmly, "the surgeon reported that the patient went into cardiac arrest immediately after the medication was administered." I nodded slowly. "I know." She slid one of the reports across the desk. "And according to the medication log, you administered that dose." That part was technically true. My ID badge had been used to confirm the medication, but that wasn't the whole story. "Who prepared the syringe?" she asked. "Claire," I said immediately. The supervisor wrote something down. "Did you verify the medication with her before administering it?" I hesitated, because the honest answer wasn't perfect. "In trauma cases, we move fast," I said. "The label looked correct." She sighed slightly. "Administration is launching a full investigation." That's when I realized something terrifying. Even if I was innocent, this could still destroy my career. In medicine, investigations take months. Licensing boards get involved. Lawyers get involved. Sometimes nurses are suspended for half a year before the truth comes out, and Claire knew that, which is why when I saw her in the hallway later that night, she looked completely calm. Too calm. She leaned against the wall outside the trauma rooms like nothing had happened. "You okay?" she asked. Her voice sounded almost sympathetic. Almost. I stared at her. "You prepared that syringe," I said quietly. She shrugged. "You gave the medication." Then she walked away. And that was the moment I understood something. Claire wasn't worried, because she believed the system logs would blame me. But Claire had forgotten one important thing. Hospitals track everything. Not just who administers medication, but who opens the medication cabinet, who scans the vial, who prepares the syringe, and most importantly, which workstation the preparation was done on. 2 days later, the hospital investigation began. IT specialists, risk management staff, hospital administration. They pulled every log connected to the trauma case, every cabinet access, every medication scan, every workstation login. At first, it looked bad for me. My badge confirmed the medication administration. But then, something interesting appeared in the logs. The medication cabinet had been opened 6 minutes before the drug was given, using Claire's badge. Then the medication vial was scanned, again using Claire's login. But that wasn't the strange part. The strange part was the dosage, because the scanned vial wasn't the medication listed in the doctor's order. It was a completely different concentration, 3 times stronger. The room went quiet when the investigator noticed that. The risk management officer looked at the screen again. "Are you telling me the wrong medication was scanned?" The IT specialist nodded. "Yes. But the system shows Daniel administering the dose." "Correct." The officer leaned back in her chair. Then someone switched the syringe after preparation. At that moment, the entire room turned toward Claire. Her confident expression finally cracked. Just slightly. The investigator continued scrolling through the logs, and that's when they found something even worse. Over the past 2 months, Claire had accessed the medication cabinet over 300 times, which by itself isn't strange for a trauma nurse. But many of those accesses happened before medications were even ordered, meaning she had been preparing drugs ahead of time, skipping verification procedures, breaking one of the most basic hospital safety rules. The room was silent. The investigator turned toward Claire. "Why were you removing medications before the orders were entered?" Claire crossed her arms. "In trauma cases, we move quickly." The investigator nodded slowly. "True." Then he opened another log file. "But trauma nurses don't normally remove medications that weren't ordered." He zoomed in on the screen. One medication appeared repeatedly, the same high-dose drug that caused the patient's cardiac arrest. And Claire had accessed it multiple times over the past weeks, sometimes during cases where it was never prescribed. The risk officer's voice dropped. "Were you substituting medications?" Claire didn't answer, because at that moment, there was nothing left to say. The final piece of evidence came from the operating room cameras. Most hospitals record operating rooms for training and legal documentation. The footage showed something small, something that lasted less than 3 seconds. But it changed everything. Claire handing me the syringe, then turning slightly away, and quickly swapping another syringe from the tray before anyone noticed. She had prepared the correct medication, then replaced it. And when the patient crashed, she immediately blamed me. The investigation ended that same day. Hospital security escorted Claire out of the building before her shift even ended. But the story didn't end there, because hospital administration reported the incident to the State Medical Licensing Board. When the board reviewed the evidence, they found something terrifying. Claire had been involved in 2 other hospitals before ours. Both had reported unusual medication incidents, but neither had enough proof to take action. Until now. Within 3 weeks, her nursing license was suspended. 2 months later, it was permanently revoked. The patient from that night survived the surgery. It took weeks of recovery, but he walked out of the hospital alive. As for me, the hospital cleared my record completely. The trauma director even called me into his office. "I'm sorry you were dragged into this," he said. Then he told me something I didn't expect. Because of how I handled the situation, they wanted me to help train new trauma nurses. So the person who almost lost his career that night ended up becoming one of the people responsible for teaching medication safety in the department. And sometimes I still think about how close everything came to collapsing. All because one nurse believed she could cheat the system. But hospitals track everything, and sooner or later, the truth always shows up in the logs.